Hello and welcome to the Wednesday Webinars for Wellbeing series. This is our second episode of our second season. My name is Marie Dahl. I'm the director of the MHPSS Collaborative, and we run these webinars together with our co-chair UNICEF of the Child and Family MHPSS thematic group, which sits under the MHPSS reference group. We're very happy to run these webinars, and we have the members of the Child and Family Group co-create them, come with cases, and contribute in many different ways. Today, we're looking at a theme called Healing Together, mental health and psychosocial support for children, youth, and caregivers, and what participation means for them, and also peer support approaches. So I'm very happy to invite you all to introduce yourselves in the chat. You can use the chat function to write your name and your organization, where you're from, if you wish. And we also would like to invite you to put any questions you might have in the Q&A box. I just realized that I'm not sure about the chat. Is that one open? Might not be. It is. Excellent. So let's go to the agenda. So today we will hear from my colleague Victor Hugo, share kind of a keynote introduction in a compressed way, really telling you about child and youth participation and what that is. We also have with us our participation facilitator, Suzanne Song, who will be helping us throughout the webinar, both with a couple of Mentimeters and also leading the Q&A towards the end. We have 3 case examples, and we found when we were gathering these different examples that the Child and Family Group works in emergencies, but when it comes to participation and participatory approaches, it's something that we often see happen more in development contexts that are easier in terms of operations. So we've looked at a span of different kinds of interventions. So we have the first one from Syria, the second one from Eastern Europe and a regional project there, and the third one from Liberia. So we start with the most humanitarian setting, and then we go increasingly developmental. And we're hoping that these different cases can inspire you and share approaches and ideas, whichever context that you're working in. We'll come together with a summary towards the end, and then we'll have questions and answers. Wonderful. So starting off, though, we will be doing a Mentimeter. We can have the next slide, please. So here you have a few different ways of participating on your side of the screen. So either you can get your phone out and you can take a shot at the QR code, or you can use the Mentimeter code here, or you can click on the link in the chat, which we will just be sharing. So we have 2 Mentimeters today, but they're both on the same link. So we're just going to do the first one, and then you can keep it open on if it's on a web browser, or if it's on your phone for the next one. So here we go. So I can share screen instead? Yes. And over to Suzanne. And if you could introduce yourself briefly, Suzanne, I'd appreciate it.
Yes. Hi, everybody. Suzanne Song. I'm a child and adult psychiatrist and humanitarian MHPSS consultant with the Collaborative. Let's check in very briefly on just to see how we're all conceptualizing this term of meaningful participation. So in your Mentimeter, think about one word that comes to mind when you hear meaningful participation of children and young people. What is the first word that comes to mind? Feel free to just type it in. Safe and play. It's by them, for them. Great. So we see a lot of empowerment, engagement, compassion, consent, great. Listening, respect. I see some people are also putting it in the chat. It's wonderful. Safe and play. So we have some commonalities. The Lundy model, interesting. We'll learn about what that is. Great. Support. Engagement in all stages. Wonderful. It's relevant. It's representative. Okay. Any others? Listening. Listening to. There's a lot of listening to, active listening. Inclusion. Anyone else? Okay. So this is wonderful. Collaboration. Great. These are all very similar, I think, and yet also a bit different. So there's not exactly consensus here on, what the term actually means. So maybe we can hear from Victor about how we should be thinking about meaningful participation. What is it exactly? Is it just a nice idea to have, or is it actually effective in improving outcomes? Victor.
Thanks so much, Susan. Good morning, good afternoon, everyone. Thank you for being here. My very big task today in the very limited time that we have is to sort of set the frame for our conversations on this topic. And the first crucial question I would like to address is what is meaningful participation, whether that's in displacement or in humanitarian and post-conflict settings, and why is it so essential, right? Now, there are many ways to define this. We can see from the Mentimeter, there's obviously different approaches that, or different things that are important to people for them to hear in defining this. So for me, meaningful participation is the active, voluntary, and collaborative process of genuinely sharing power with children and young people. It's about ensuring they have the space, the support, and the genuine opportunity to influence the decisions that affect their lives. And in the context of preparedness, emergency, or recovery setting, its importance is rooted in one core foundational reality as well as three practical realities that kind of underlie it. And the core foundational reality is that meaningful participation is a fundamental right. It's not an optional nice to have. It's an obligation that is enshrined in international law. We find it in the Article 12 of the UN Convention of the Rights of the Child, which guarantees that every child capable of forming their own views to express those views freely in all matters affecting them, and for those views to be given due weight in accordance with the age and maturity. But what is crucial, though, is that the UNCRC is not a peacetime luxury. Its principles apply at all times. And one could even argue that they become even more critical during emergencies when decisions are being made that profoundly impact a child's safety, well-being, and future. And they're even just as essential in preparedness. So fulfilling this right is therefore our baseline, and it's our legal and ethical starting point for all forms of humanitarian action. Now, this rights-based foundation gives rise to three practical realities that we see demonstrated in our work every day. The first is that it is a core component of psychosocial well-being. When we have unrest, emergencies, and displacements, these are by their nature disruptive. They can strain social support systems, interrupt routines, and reduce a person's sense of influence over their own life and environment. In this context, providing opportunities for participation becomes a key protective factor. The very act of making choices, contributing to solutions, and collaborating with peers helps strengthen coping mechanisms and builds self-efficacy. It also contributes to countering potential feelings of helplessness and helps in reinforcing children and young people's inherent capacity as active members of their families and communities. The second is that it's a programming imperative for quality and effectiveness, because when we co-design programs with families and children and young people, those programs are just simply better. They're more relevant to their actual needs, they're more aligned with their cultural values, and they're generally more accepted by the community, which leads to higher engagement, greater ownership, and more sustainable outcomes. It is basically literally the difference between delivering a service that we think that they need and facilitating a solution that they know will work. And here the humanitarian sector can learn quite a bit from development actors who have been working on this approach for much longer. The third is that we know it is beneficial because there is a growing body of evidence that demonstrates its impact. This is an evidence-based practice, and we can see the results across different domains. And some of that we will hear from a few agencies themselves in just a bit. But one of the things that we need to keep in mind is we need to be honest with ourselves. Not everything that is labeled participation is actually meaningful. There is a whole spectrum of engagement, and it's critical to understand where our own practices fall. To help us navigate this, I, just like many in our sector, find it very useful to think about engagement across three distinct categories. The first is what can be called non-participation, and this is when young people are involved, but without any genuine understanding of our choice. So think of it as children and adolescents that are asked to perform a pre-written play about overcoming sadness for a mental health campaign using a script that doesn't reflect their own experiences or coping strategies. While it may look like a psychosocial activity, the lack of agency makes it non-participatory. The next category to think about is sometimes more subtle and but actually very common, is tokenism. And this is where young people are given a voice but not a choice. A classic example that I see is conducting a focus group discussion where adolescents are asked what kind of support activities they need, only for the agency to roll out a prepackaged standard curriculum because the funding was already decided. This gives the appearance of influence, but the power and decision making remain firmly with the adults. Now, this brings us to our goal, which is meaningful participation, and this is where the genuine sharing of power begins. It kind of exists on a spectrum, and different schools of thoughts have different ways of categorizing it. It can be consultative, it can be collaborative, and at its highest level, it can, have different forms of adult and youth-led partnerships or completely be led by young people. Now, the defining feature of these categories is a commitment to a process that is transparent, respectful, and genuinely influential. Looking at all the different categories, whether it's non-participation or tokenism or meaningful participation, it can get very intimidating. I know that. And therefore, it becomes very important to acknowledge that facilitating meaningful participation is a journey of learning and growing. And we are all at different points in this journey, as no one organization or person has it all figured out. One thing to keep in mind, though, is that for these different levels, the goal is always to facilitate the best and most appropriate level that is linked to the context, our own capacity, and the resources that we have access to. And we must continue to hold ourselves accountable to keep on growing in this area. The risk of not listening due to the urgency of a response is significant. We risk designing programs that are irrelevant, ineffective, or sometimes even harmful, because we fail to understand the context from the perspectives of children and young people themselves. Because while risk is real and resources and capacity might be scarce, these are not reasons to avoid meaningful participation. Instead, they are actually mandates. They are mandates to invest in the preconditions that allow us to use the approach that best engages and shares power with children and young people. For organizations and other actors in our sector, in our space, this means that we must start to think about integrating meaningful participation into our pre-existing response preparedness processes. And regardless of which level of participation that we're facilitating, the key question that comes in now and then is how do we do it right? We cannot simply announce the door is open for participation. It doesn't work that way. We must be very active and intentional about creating the conditions for it to flourish. A powerful way to think about it, about building these conditions, is through the Lundy model, which looks at it through four interconnected parts. The first is creating space. The second is facilitating voice. The third is ensuring an audience. And the fourth is enabling influence. Uh, when we talk about creating space, this is very much the foundational and ethical bedrock. It means ensuring that participation is always voluntary and that the spaces that we create, whether they are physical or digital, are genuinely safe and inclusive. And now the safety is much more than physical safety. It's about creating emotional and cultural safety where every child, every young person, and the caregivers, especially the ones that are most marginalized, that they feel respected and are able to express themselves without fear or pressure. The second thing we must do then is to facilitate voice, and this requires that we are transparent and informative, giving people the very clear information they need, that is age appropriate, that actually informs their opinion. It also means that our approach must be relevant and adapted, respecting their choices and their choice to express themselves in whatever way is most comfortable and aligns with their lived reality, whether they use words or art or drama or digital media. The third is that they must have an audience. A voice is meaningless if no one with the power to act is listening. Now, this is our commitment to being respectful listeners. And then I can see that come through a lot in our Mentimeter. And it means ensuring that their views are heard seriously by the actual decision makers, whether that's someone who's the director or a community leader. And finally, and most critically, their voice must have influence. And this is where the principle of accountability comes into action. It means their views are not just heard, but are genuinely considered in the final decision. And it requires that we provide a very clear and timely feedback on what has changed as a result of their input, explaining the why, even when a suggestion cannot be implemented. So it's not just about how their voice has informed the decision or on decision what has been taken forward, but also um, making sure there's a feedback loop to inform them of as to why their suggestions are taken forward. When we commit to these principles and preconditions, we create a space for powerful participatory activities to thrive. And more importantly, we sort of ignite a virtuous cycle. A young person participates in a safe and meaningful way that contributes to reinforcing their sense of agency. As the agency is reinforced, the well-being is supported. As the well-being is supported, they're more capable and more willing to engage further and creating opportunities for others. Now, this cycle is the engine of sustainable community-owned support systems. So to round up, I want to leave you with a challenge. In your next team meeting, in your next project design and emergency preparedness sessions, I want you to flip your starting question. Instead of asking, what do these children and young people need from us? Start by asking, what are the strengths, what are the capacities and ideas that are already present within this community? And then follow that up with the most important question of all, which is, how can we build a partnership that puts their expertise at the center of the solutions? When we make that shift, we move beyond simply being providers and practitioners and instead start to become partners in building more effective, more dignified, and community-owned MHPSS responses and interventions for children, youth, and caregivers. Thank you.
Thank you so much, Victor. Great to hear that background. And now we've come to then follow some of that theory with concrete examples. I'm very happy to welcome here Abdel Khader, who is the Global MHPSS Advisor for the Middle East, based in Jordan. And he's going to share a little bit about their work of International Medical Corps in Syria specifically. And I'll hand it over to you, Abed, to share briefly what it is that we're going to be able to see in a video that IMC has put together.
Thanks, Mary. Actually, I will start talking about MHPSS in Syria. IMC has a big program in Syria. This is program integrated with different sectors, integrated with health as well with the CP and sometimes with GBV. This is based on where the services provided. At the same time, in the upcoming period, we will talk about or the examples that we will present it now. We choose some caregiver and their children. They participated in some activities related with MHPSS. And we will talk about those scenes and what the main points that the caregiver, what the main point that caregiver raised by them. So this is actually in general, and we can start it with the scene, Mary.
Okay, great. So
مشاركة ابني بتكون أهم. صار عنده القدرة على التواصل، صار عنده كون صداقات، صار عنده تنمية المهارات الإبداعية. رأيك في عوائق بتحد من هذا الموضوع؟ هي أكيد موجودة عوائق. وجهة نظرك شو هي؟ عندك ضيق الوقت بسبب التزامات الأهل، إنه كونك عندك الأولاد، عندك زوج، عندك بيت، عندك ضغوطات النفسية عند الأهل، في عندك عادات والتقاليد.
برأيك أستاذ إنه هاي الأنشطة أو مشاركة فعالة أو لها أهمية؟
الأنشطة أنا حضوري فيها جدا، إنه بتعطي الثقة بالأطفال، بتساهم بشكل إيجابي بشكل ضمن النشاط، بتساعدوا على تطور بالعمل فيها.
في مشاكل أو تحديات أو أشياء تمنع هاي المشاركة؟
أكيد أكيد أكيد. حتى ممكن في عندنا العادات والتقاليد هي بتأثر كثير على الحضور، بيروح يحضر مركز دعم نفسي، في عندك الخجل، في عندك الخوف، في عندك الأهم الفقر، يعني ضد الفضاء بيروح يدور على لقمة عيشه. في مثلا عوائل فيها ما رب الأسرة متوفي، ما بتخجل ما بتروح على مركز دعم نفسي، ولكن هاي الأنشطة قد تكون كثير من هاي العوائل، من الخجل، من الخوف، من الوصل الاجتماعي، هي كلها تخفف منها هاي الأنشطة قد تكون ضمن المجتمع.
نظرك شو هي أهمية مشاركة الأطفال بإعداد الأنشطة يعني نفس الأنشطة الزوجية؟
طبعا بالنسبة لمشاركة الأطفال في إعداد الأنشطة ضروري إنه يختار الطالب النشاط اللي هو راح ينفذه بيكون فعاليته أكبر. هاي بالدرجة الأولى يعني.
طيب أنت كمقدم لوعي مشاركتك في إعداد الأنشطة كمان مهمة؟
طبعا مهم يعني أنا أي نشاط الشباب بيعملوه للطلاب بكون موجود. طبعا النشاط لازم يكون موجود فيه المشاركة الفيزيائية إلي والعملي. السبب هي نقل هالخبرة هاي من الشباب لباقي الطلاب لاحقا ممكن ما يكون موجود، فهاي الخبرة لازم تكتسبها وتكون موجود من شان الخارج.
نقطة من الفوائد اللي خبرتني عنها، ايش هي العوائق او التحديات اللي واجهناها بمشاركتنا باعداد هاي الانشطة سواء الاطفال او المجتمع؟
هلا موضوع التحديات غالبا لا يوجد تحديات، ولكن في شغله بسيطه راح اقول لك اياها. هي احدى التحديات اللي انا حاطط نقطه عليها، هي المكان الملائم والمناسب لتنفيذ هالانشطه هاي بتكون افضل يعني.
طيب انت بتحب تكون موجود مع بتنفيذ الانشطه الفيزيائيه مع الاطفال؟ مع اطفالك؟
طبعا.
ولا في راي اخر بالنسبه للموضوع؟
طبعا ضروري انا قلت لك انه هذا الموضوع بالذات وجودي اثناء تنفيذ الانشطه ضروري، هي اكتساب خبره وهي بنفس الوقت يعني اذا كان في اي ملاحظات بوجهها او في عندي اي شيء بدي يعني اقدم خبره من عندي او خبره اكتسبها، هاي ضروري.
Thanks, Suzanne. And really, I will have some comments regarding to clip video, this clip video, and I apologize for if there is any problem in technical issue, but so this is what we have now. Okay, there is some points that I need to raise. And this point actually it's coming through the caregiver presentation or the caregiver that what they presented during this interview. The main thing that I can say, the children healing is stronger with the caregiver participation, really, because this is one of the aim of the MHPSS to heal the children, to make them more stronger. So if we need to reach to this point so that the participation of the caregiver, it's very important. In general, the healing doesn't happen in isolation. It happens when children feel supported by their caregiver as well. So their participation, it's very important through their viewpoints. Some challenges hinder the caregiver participation. Caregiver spoke honestly actually during the video clip talking about their participation. But at the same time, there is some challenges we need to address, like the poverty, the customs, stigma, and shame. At many times, the family duties and the family obligations around the people around them, all of these actually, it's main challenges we need to address when you're talking about poverty, so that we need to think about providing transportation, for example, if it's needed. When we're talking about stigma, that means we need to increase our work toward fighting this stigma and so on. So all these points from my side, it's very important and crucial to arise it in this situation and in this panel exactly. Also, caregiver commitment. This is very important. What we mean about caregiver commitment, that's mean if the caregiver, they follow up their children, that's mean we will catch the improvement of the child. We will see the healing of the child more stronger and more quickly than normal way. So many caregivers said they came not only for their child, but also to learn something they can share with the others. And this is very important. That means the participation, it's not only for the child themselves, but also for the caregiver. Actually, one of the programs we take the caregiver through it, the TRT program, TRT Teaching Recovery Training for the caregiver. This is program actually required from the caregiver to participate at least in 2 sessions. In the beginning and in the middle of the program, the aim of this participation only to psychoeducation, providing psychoeducation for them, at the same time to empower the child and to speed the healing process. So there is different meaning for commitment of the caregiver and different meaning of the participation of the caregiver themselves. Next, please. Safe place. Actually, when Victor he talk about when he provide his presentation, he talk about safe place, because safe place is very important, and finding the right place for activity is essential. Safe place is encouraging the caregiver to come. If not, even the most willing parent may be hesitated. So really, if we didn't provide this safe place, first of all, not only the child will not come, but also the caregiver, they will hesitated also to participate. So providing safe place, as Victor says, is very important. Healing is shared. Caregiver sees themselves as a part of the healing, and this is very important here. We need to deal with the caregiver as a partner, not as guest in our interventions or as a consultant. No, we need to deal with them as a partner. What we mean about partner, that means the caregiver need to participate from the beginning of the program, in designing the program. And this is, we need to complete it during the sessions and take their review and take their comments during the implementation of the program at the end, after the program finished. Also, we need to contact with them and take their review about the program. Next, please. So recovery is not just about the child, it's about the family, the neighborhood, and the wider community. If we include caregiver as real partner, address the stigma, and make sure activity are safe and practical, we can building something that lasts for longer with the children, and this is what we wanted. We need our intervention to be for long period more than it's a short period intervention, and I am sure all of us we're looking for that. Yeah, thanks for all. This is my presentation to you, Mary. Actually, this is all this recommendation. We're talking about the design activity, awareness meeting, safety space, and linking with livelihood support. And support can make it easier for caregiver to participate. Here we're talking about livelihood support, because many of the children, many of the caregiver, they says one of the hinder or one of the things or the challenges, it's the family commitment. So if we can make or we connected the livelihood support with the child or with the family participation, this will be good. Also guide the caregiver to encourage other caregiver to participate, because this is very important. If the caregiver feel he is well and he is welcome and his child benefit more, so he will encourage other participants to or other caregiver to participate. It collaborated with communities to jointly selected spaces treat caregiver as partner instead of seeing them as beneficiaries in the process. And thanks all, and to you, Mary and Suzanne. Yeah.
Thank you so much, Abed. And apologies for the video challenges. There is an unsolvable situation we have, but we do the best that we can. So next we will hear from Eastern Europe and from Anastasiia Doroshenko, who will be telling us a little bit about Unity in Care, which is about advancing mental health support systems for vulnerable children and youth. She's a regional child protection advisor for Europe, working with Terre. Over to you, Anastasiia.
Thank you so much, Mary. In this segment of the webinar, I have the pleasure to share about our original project, Unity in Care. Within this project, please, let's stay on the previous slide. Yeah, we can stay a little bit more. Yeah, thank you. Within this project, TDH and our partner in Albania, Nisma ARSIS, are working together to strengthen different levels of children's socio-ecological levels, paying particular attention to children from vulnerable and disadvantaged socioeconomic backgrounds, and those children who experience structural barriers to having their voices heard. We work at the levels of formal and non-formal systems, at the level of peers, family, and community. What is cutting across these different levels is a child rights-based approach to participation. And as one of numerous examples, the Unity in Care project logo you can see on this slide was co-produced with the child advisors to this project. And in the next slides, I will unpack our approach a bit more. Please, let's continue to the next slide. Thank you. So the Unity in Care project is being implemented in Romania, in Greece, Kosovo, and Albania, being coordinated by TDH Regional Hub in Hungary. Within this project, we bring together a range of preventative MHPSS instruments used by both mental health professionals working in school settings, for instance, psychologists, and non-mental health professionals working in community centers. So community workers, youth workers, animators, facilitators. What is important to highlight is that all of them are highly participatory and they complement each other in terms of their objectives, in terms of children's age range and the levels of children's participation, be it consultative, collaborative, or child-led. It's also important to say that in each implementing country, partnership with children started right from the beginning. So each partner had a series of consultative workshops with children to contextualize these methodologies to make sure that they are relevant to children's different realities. So for instance, you can see on the slide, moving from left to right, TDH methodology, movement, games, sports, and creativity that uses sports, games, and creativity as a psychosocial tool to develop the personal and social skills of vulnerable children aged 6 to 14, and therefore to improve their resilience and psychosocial well-being. Another TDH methodology called Move and Engage Youth Curriculum that aims to support children and youth aged 12 to 20. And one of the key aspects of this methodology is the development of concrete youth-led initiatives to address some of the challenges to their well-being in the environment. We also have I Support My Friends, which is a resource kit developed by UNICEF, Save the Children, and WHO that aims to facilitate training of children, of adolescents aged from around 9 to 17 in how to support their friends in distress using the principles of psychological first aid. And last but not least, walking the journey amidst challenging circumstances, which is a methodological toolbox for establishing, supporting, and sustaining child and youth advisory boards along the Nexus approach. This methodology was initially developed for the context of Ukraine. Please, let's move to the next slide. All right. International and national child advisory boards, CABs, are an intrinsic part of the Unity in Care project governance. So in a nutshell, CABs is a group of around 12 children established and supported throughout the project implementation. The main aim of CAB is to ensure that children's voices inform project decision-making processes. So some of the examples would include children co-producing project visibility and information materials. Children also participate in consultative workshops for contextualizing MHPSS methodologies, and moving forward, they will also co-produce policy briefs. Another example is that children from international CABs support the establishment of national CABs in their respective countries, and based on their willingness also contribute to facilitation of national CABs. TDH's CAB methodological toolbox, the one you see on the slide, is what we use to support our work with CABs. It's a very practical tool. It offers facilitators a whole range of knowledge, concrete activities on how to safely, ethically, meaningfully engage children in advisory roles and decision-making processes. Importantly, it offers facilitators the know-how of how to structure the meetings with child advisors and populate them with activities that are both safe and empowering for children. And here, for example, we engage children along the lines of what we call Avenue 1, so co-production of tools, services, activities, policies, or Avenue 2, which is participatory action research, or both of them. The toolbox has a whole range of tools, for instance, how to formulate eligibility criteria for CAB membership, how to draft a CAB terms of reference, how to advertise this opportunity to children, how to conduct interviews with them, to secure informed consent, informed assent, and importantly, how to support sustainability of CABs following the project completion, and many other tools. And we also have an in-country contextualization guide to support adaptation of this toolbox to different contexts. And to give a better sense of CABs, now I would like to give the floor to Rafaela from Albania to share with us some of her experiences of being child advisor.
Hi, and thanks a lot for giving me the chance to share my experience with the Child Advisory Board here in Albania. This is my first time being a part of something like this, and it feels powerful because our voices, our ideas, and our perspectives are not only heard but also shaped by our own commitment as young change makers in our community. And what is most powerful is the cross-border exchange of ideas that we share during our online meetings with peers from Kosovo, Romania, Greece, and Albania. I joined the CAB through the Unity in Care project because I really wanted to stand up for those who need the most support and turn their energy into real action. Sometimes the steps we need to take aren't that complicated, that we just need to connect people's energy and potential with the right opportunities for the future. What I've realized is that young people in Albania, including me and my peers, we are basically on the same tune. We don't have more or less than one another. It just sometimes opportunities come in different shapes, and that's why it matters, that we unite and take care of each other. For me, that's exactly what Unity in Care represents, a movement, a vibe, a model of how we can take ownership of our well-being, make decisions ourselves, and still be guided by the wisdom of adults. I'm really excited to keep learning more, to keep building with the Nisma ARSIS team, and to turn our collective actions into meaningful contribution alongside my peers.
Yes, with that, we are gradually moving to our key recommendations. Firstly, it's well known from both research and practice that oftentimes there is a tendency to perceive children's rights to participation and children's rights to protection as being in tension with each other. As a result, all too often children who are perceived vulnerable are excluded from participation. However, what is increasingly known from research and observed in practice is that the more vulnerable a child's background is, the higher the need for meaningfully engaging them in decision-making processes, ensuring, of course, that the necessary safeguards are in place. Secondly, it's important not to make assumptions about children's capacities, about what they can and cannot do. Perceived lack of children's capacities should not be used as an excuse, as a justification for denying their participation. While it's important to continuously strengthen children's skills, it's equally important to provide them with opportunities to put their skills in practice, for them to see visible results of their actions. And finally, different levels of child participation, be it consultative, collaborative, or child-led, are equally valuable. They can effectively be combined depending on the context, on children's wishes and needs, and task at hand. As such, they can evolve even within the same project. What is paramount is our readiness, our positive attitudes to let the voices of children and youth lead their journeys, even amidst challenging circumstances. Thank you very much.
Thank you so much, Anastasiia, for sharing from the experiences that you have in Eastern Europe with Terre. So we've come to our last case example, and that one we bring to you from Liberia. It's about promoting youth participation in MHPSS through adolescent peer support groups. We will hear from Action Against Hunger, Bofa Washington Baslow, who's the MHPSS head of department. Thank you so much for joining us, and over to you.
Okay, thank you very much, Marie, and good afternoon, good morning, good evening, wherever you are. My name is Bofa Washington Baslow. I'm the head of department for cases in Liberia with. So today, I'm happy to share with you a case example on how we are promoting youth participation in MHPSS through adolescent peer support groups. Next slide, please. Thank you. So for our adolescent support group project, which we refer to as the APSG, is currently being implemented in 3 of our counties in Liberia. So we have one of the counties being an urban county, but the project is implemented in the rural part of the county. And then there's another in the central level, as well as the northern part of Liberia. This approach was initially piloted through an Irish aid-funded project called the LWC, that's the Liberia Watch Consulting Project, in few of our communities. And based upon the positive feedback we got from that implementation, we decided to scale up to other counties under the BHO project right now that is ongoing, which is funded by the French Development Agency, AFD. This project is actually implemented in partnership with one of our local MHPSS partners called the Liberian Association for Psycho Services, for short. And our overall aims or objective for these adolescent peer support groups within the counties is actually to help promote positive behavior change, improve life skills among adolescents by discussing and sharing experiences on topics such as self-esteem, positive coping skills, and emotional management. We also teach them on how to discuss and share critical thinking and decision-making skills, empathy and respect, hope for the future. And they are also sharing this knowledge that they gain with their family and other community members in their various communities. Next, please. Okay, so I will just show highlights on how we implement the strategy of our adolescent peer support group through a collaborative participation with the adolescents with whom we work. So initially, before the design of the activities that we intend to do with them, we carry out a community identification and selection, and we also do community entry meetings where we have key community stakeholders, including youth leaders, women leaders, men leaders as well. And during that community entry meeting, we present the project and we also share the benefits of the project with the community. From that engagement, adolescents will willingly and voluntarily opt to participate within the activities that we have for the adolescents. So we usually share that, to have these groups form, you have to fall within the age range of 9 to 19 years, and the maximum number of participation or membership per adolescent peer support group is 15. So once we have formed these groups and have identified the beneficiaries, we then have a discussion with these group members, especially the adolescents themselves, to identify topics and issues that are of importance to them, issues that they would like to talk about. And they will share with us topics and issues that they would like to discuss and participate in. And then we as a team, ACF and our partners, will then go together, develop the contents using these topics that were co-designed with the adolescents, and then ACF would do a TOT for our partner staff. And then our partner staff will now go and do a training of the adolescent leads and a co-lead on facilitating the adolescent peer support groups. During the sessions, the adolescent peer support group members are the ones who decide what topics or what discussions they will have during each session as they meet. And they also have the opportunity to decide when, where, and how often they will meet to have these sessions amongst themselves. The adolescent peer support group members also have the opportunity to discuss these topics and other related issues that affect them, and they are also encouraged to openly and freely share experiences that will enable them to support each other. Our partner staff, of course, are always there with them in the field to provide support to the lead and the co-lead adolescents during the facilitation of these sessions, and also do conduct home visits to be able to monitor the changes and what are peer support group sessions. And like I mentioned earlier, these adolescent peer support group members are also engaged in their communities because they feel and think that the information, the discussions, and the issues that they are discussing within their group and what they are learning will also be beneficiary for members of their household and other community members. They organize outreaches where they do awareness and also share information with other community members and their households. So to be able to facilitate their engagement among themselves, with their household, and also with their community members, we do provide educational materials and recreational sporting materials for them that helps to promote social cohesion among group, promote participation, and also facilitate the process for them to be able to conduct awareness sessions within their communities. Next, please. Thank you. So these are the session contents, and these sessions are usually facilitated by our local partner MHPSS staff in collaboration with the lead and the co-lead of the adolescents. So typically we have the first, which is the introductory session, and the conclusion sessions that are delivered by our partner staff. And the essence for doing this is because during the introductory sessions, we have pre-assessment tools or skills that we administer. So for example, they do a pre-assessment using the perceived social support and suffering skills, and they also do administer the Rosenberg self-esteem skills. So because these tools are new to the adolescents, the partner staff are there to support them through doing the assessment. And that first session also does serve as a means of demonstrating in real life how to facilitate a peer support group session, so that after the TOT for the lead and the co-lead adolescents, they can see in real time, so that their confidence and their comfort can also be developed and established for them to take on to lead the sessions from session 2 to session 12. And then the last session also is facilitated by our partner staff because there's also a post-assessment that needs to be done. And then they also use that session to collect feedback and reflections from the adolescents on how the project was implemented. Next, please. Next slide, please.
We have the next one, but I don't think it's come through to you yet.
No, not yet. Okay, now I got it. Okay, so from implementing the adolescent peer support group, we have had some positive outcomes, and we also have some challenges that we will also be talking about. So this approach has actually helped adolescents to find a space where they are able to talk openly about their mental health issues, peer pressure, and substance use problems amongst themselves. And these are usually within the communities where we implement are considered as either a taboo or people do not really know about mental health. So talking about this amongst themselves has actually served as a safe place. So for example, one of the adolescents said, and I quote, through the group activities, I learned communication skills, goal setting, and how to think positively. These interventions have also helped our participants and adolescents to feel more comfortable and confident with essential life skills. They are able to share the knowledge that they've gained happily and openly with other community members and even other adolescents who are not members of the adolescent peer support groups in their communities. And it has also helped them to increase support amongst them. So one of them told us that when I see someone who is sad, I try to help. I will bring a joke and make them laugh. I enjoy doing this, and it makes me feel happy when I support someone. On the flip side, there are, of course, challenges we have encountered. And the previous speaker has also mentioned that stigma and discrimination continues to prevail, especially for pregnant adolescent girls. So within the groups, they are saying, or they are perceived to be seen as positive role models. So once an adolescent girl is pregnant, who is a teenager, they cannot be perceived as one. And then another thing has to do with trust issues. As we're aware that, discussing MHPSS is a sensitive issue. Some of them are actually not so, free and open to discuss these sensitive issues amongst their peers due to trust issues. Then to shift from top to bottom or a more interactive participatory approach has also been an issue because they are always used to this top-down bottom or top-bottom approach where they have an adult always giving them the information. So now taking on the lead to lead their activities, organize and share experiences on their own has actually been a challenge. And of course, ownership and sustainability also is an ongoing challenge that we face, especially where most of the projects in MHPSS is actually donor funded. So once the funding is exhausted in the project process, sometimes most of these groups are difficult to sustain. Next, please. So for our key recommendation, we would like to recommend that you ensure activities are designed to implement adolescent peer support groups, are designed by the youth and for the youth. We should be able to involve the youth and the adolescents as key decision makers at the design stage and as well as the implementation stage of the groups. And we should also ensure that we measure the changes of the group through pre and post assessment skills. Thank you very much.
Thank you so much, Bofa. Wonderful to hear of your work in Liberia, a different perspective on participation. I'll invite Suzanne now to kind of do a wrap up of the different recommendations that we've heard and In the meantime, I'm also reposting the Menti in the chat. It's the same one, so for those who already have it open, you have it. And for those who didn't quite manage to get onto it, you can get onto it as I hand over to Suzanne.
Wonderful. Thank you. Thank you, everyone, for your work. It has been so helpful to learn about these very high quality examples of meaningful participation from the consultative process, collaborative, and youth-led. I think we now have an operational definition, both theoretical and in practice, as meaningful participation as the active, voluntary, kind of collaborative process of sharing power with children and young people, as Victor had defined. So to summarize the recommendations for today, we can move beyond simply being providers and practitioners and instead become partners with children and young people to put their expertise at the center of solutions. We can include caregivers and communities as consultants and collaborators, ensuring barriers to participation, like logistical issues or stigma, are addressed. We can create space, voice, audience, and influence, for example, these child advisory boards, especially for children who come from very vulnerable backgrounds. And we can ensure that children are the key decision makers and monitor the effectiveness of participation, for example, in peer support groups, which can improve the psychosocial well-being of children and adolescents. So I hope everyone has had a better understanding from today of what it means to have the meaningful participation of children, young people, and caregivers. And I know I've learned quite a bit. And so now if we go to the Mentimeter, we'll ask you, what is your key takeaway from this webinar? What is something that you'll start or stop doing, or you'll do more of? Basically, what is the next action step that you'd like to take after today? So in the chat is the Mentimeter. Feel free to type in your response. What is your key takeaway from today? So we can click on the link and use the code. Does anyone have thoughts about what you might like to try to implement in some of your work? It looks like people are still seeing the original question. Ah.
So you need to click next.
Well,
when you go to the Menti, you need to click next question, and then you'll come to this one. I just did so. There you go. Someone got there.
okay. And if it's not working in Mentimeter, you can feel free to just write in the chat as well. So supporting children and youth should not be done in isolation. Families, caregivers, and children themselves should be empowered as a system. Wonderful. Caregivers can be partners, working through child advisory boards, involving adolescents through meaningful participation in peer support groups. Great. Inclusion of the whole family. Wonderful. I think we often don't think about the family unit when we think about meaningful participation of children. Resources shared on how children can support their friends and peers. Great. Yes, this must be hard for people who have poor connection. That's okay. Feel free to chat. You can write in the chat box. Not assuming capabilities of children and asking them through the process. Great. A lot of these takeaways are minimizing the asymmetry of power, I think, inherent. Be intentional about when we use what approach, consultative, collaborative, or child and youth-led. It's a journey. The goal is always to facilitate the best and most appropriate level linked to the context, our capacity, and our resources, right? So matching the approach to the context. Participation of caregivers is also a crucial role in supporting child mental health. Yes, again. And then co-learning, empowerment, and community-led psychosocial support activities work with parents and youth to enhance the impact. Great. Wonderful. Okay. And maybe we'll, creating a safe place. Yes. And being more child-centered. I think that's the heart of this. Yes, is to really center the child, empower them. Start from the strength of children and young people. Wonderful. Too often, I think we look at vulnerabilities and risks, and this is really shifting that to focus on their strengths. Any last thoughts that people want to place in Mentimeter or in the comment, the chat box?
Actually, maybe feel free to keep them coming if you're in the midst of writing something. We'll collate them all and also share it with the proceedings of this webinar. As Susan takes you on to kind of opening a bit for the questions and answer, which is the final part of our webinar today.
So everyone has a Q&A box. You can feel free to please put in any questions there or in the chat box, of course, while you're writing and thinking of questions. There are a couple of questions already that maybe I'll start with. One is, I think probably to Abed. How did the weight of poverty hinder caregivers' participation in their children's healing?
Yeah, thanks, Suzanne, and thanks for the person who asked this question. Really, when we're talking about poverty, that's mean first the family they will be engaged in daily based on searching for their food, for having the requirements for the families, and in some context, this activity it will take all the family efforts and all the time, and it will booked all the time. So this is very important. So based on that, one of the recommendation we raised that if we can correlate this or make connection between livelihood and family, this is will empower them. So poverty actually it will affected all the family. If the family they didn't find what they eat, if the family they didn't find their basic needs, that's mean the family, all the family, they will work hard only to justify this need. And if we return to Maslow, prime, we will see in the bottom of the this prime, we will talk about the psychological needs, and one or part of the psychological needs, it's the food items and all these necessary things for living. So if the family it will be occupied and busy on only justifying this issue, they will not looking behind that what coming next. So the poverty, it's one of the big issues that we need handle, and at the same time we need to thinking about it. Yeah, this is my side, Suzanne.
Wonderful. Thank you for that, Abed. And there's another question here, I think for Anastasiia. I'm interested to hear about strategies for sustaining child advisory boards after initial project conclusion. With so much MHPSS work being unfortunately project-based, one common challenge is how to ensure ongoing participation through mechanisms such as CABs and ensuring inclusion in early design stages of future initiatives. Great question.
Thank you, Susan. I couldn't agree more with the concern shared by Felicity about difficulties to maintain participatory processes following project's completion. I think it's possible to answer this question from several perspectives. Let me touch base upon just a few of them. Participatory processes can mean, and constitute in reality many different things. They can be formal, they can be non-formal. Of course, here specifically, we talk about formal participation within projects. Nevertheless, participation processes that are most common are non-formal. Children's participation in the context of their family, in the context of their community, which are part of children's daily lives. And if within our project we can change attitudes of adults towards hearing children's voices, not once a week, not once a month, but every day within their daily realities, I think it's already a big step. If we talk specifically about projects, again, a good place to start, drawing to the end of the project, is to discuss with children what are some of the ways that you would like to stay connected, what are some of the ways that you would like to stay engaged, and which support you need from us and from adults in your community. Again, good place to start discussions with children. Some more concrete things could include, for instance, organizing annual meetings with the child advisors to convey a message that their contributions to their communities were appreciated that time back in the beginning of the project, and they remain appreciated in the now. So coming together on a regular basis. We could also consider inviting child advisors to act as mentors for new CAPs. So for older children to mentor younger children, also supporting this intergenerational dialogue, peer-to-peer support, so participatory processes would be less top-down. I also believe that in every country, in every region, also globally, there are already many established participation structures and mechanisms. It's good to identify them and link children with what already exists. Perhaps some of such mechanisms or structures are not very inclusive, so we can advocate for including diverse group of children, including the ones from vulnerable backgrounds. We can also invite them for webinars just like this to share with us their previous experiences and how they are applying the knowledge and the skills that they learned in their daily lives. Yeah, perhaps to sum up, for me, one of the key messages to say that participation, non-formal participation, is equally valuable as formal participation. And if by virtue of our projects, children's roles in daily lives, in everyday lives, are strengthened, it's again, it's a significant contribution. Thank you.
Wonderful, thank you. And I do just want to read a comment here. Speaking about country Palestine and the reality that children in Gaza are living through. At the moment, I believe there's little room for sustainable interventions as we are facing numerous obstacles. The most urgent priorities are working on ensuring safety and saving lives. I believe there's a critical need for substantial efforts to create new methodology for supporting children and families, one that responds to their current reality with compassion and resilience. Yes, and I think we all, as Victor had mentioned about this earlier, the meaningful participation of children and youth and caregivers is not only done in times of stability, but also in times of active crisis and conflict. And while extremely difficult to do, I think there are different, and maybe I can open this up and see what other thoughts are. Abed?
Yeah. Yeah, thanks. Actually, I need to have some comments or some reflection on this comment. Actually, I am talking here from Gaza, and I totally understand what mentioned inside this comment. But at the same time, what I need to draw the attention for all the people here and all the people that are hearing us. Okay, ensuring safety and saving life, part of it. Caregiver participation, because we need to empower the caregiver and we need to empower at the same time the children, and our MHPSS intervention or all our support for these children is necessary to saving their life and to making them coping and can functioning very well in these circumstances. So from my side, we need to extend the picture and looking for all MHPSS activity as part of life saving. Actually, it's not something additional. I know totally the people here, they are looking for food, they're looking for safety, they're looking for their basic needs. But at the same time, if we didn't support them in a proper way, that means they will lose themselves in some stage. So our intervention in this stage is very important and very crucial in these circumstances. That's all.
Thank you, Abid. I think that's extremely important. And to whomever posted, Swasan, thank you so much for your work too. And I think maybe we have time for one last comment from Ghada before Marie takes over. Yes, go ahead, Ghada.
Thank you very much. And I would like to add my voice to what Dr. Abdel Karim said, and also to consider it part of the important public health activities that we are implementing in emergencies. It's a preventive methodology that can help children and their parents to avoid having more complicated mental health issues in the future. It's also good for peace building in our communities when we are bringing all the children together with their parents from the hosting communities, from the IDPs, from the different returnees or different, like people, minorities in the communities. It's a very good activities that's even building and empowering the community itself. I see it as a very essential interventions, not only regarding, empowering the children themselves, but also building the communities in a good basis, full of, thinking of future and the prevention factors that can maybe lead to best or better well-being for the population in every situation. Thank you very much.
Thank you so much, everyone. Looking at the time, we have come to the very last minute of today's webinar. I want to really thank you, all contributors, Victor, Abed, Anastasiia, and Bofa, and Suzanne, for helping with the participation of this webinar. We will be sharing this one by start next week with everyone who was registered to this webinar. And it will also be available on the MHPSS Collaborative's webpage. If you want to see the 2024 webinars, you have them all listed here. And I believe we will also start to add the 2025 webinars on the same link. But you'll get an email with everything that we have shared here. And we really hope that you will bring some of the inspirations and the learnings from this webinar out into the world, in where you're implementing interventions for the mental health and well-being of children, youth, and their caregivers. Take very good care of yourselves, and the next webinar is going to be on arts-based interventions for mental health and well-being, and it's going to happen in November, and you'll hear more about that in the different networks that we advertise this webinar in, including on the MHPSS Collaborative's webpage. Thanks, everyone, and have a good afternoon and evening. Bye-bye.